Type of cancer. 28 most common oncological diseases. Interesting about science and medicine. Prepared by editor of a page All Scientific. How is cancer classified? One of the most familiar classification of cancer types depends on the location of a primary tumor. As a rule, the localization refers to the affected organ or tissue. Tracheal lung or bronchial cancer. Main characteristic of a disease: about 95% of all cases of a disease are seen in people who smoke. It is the most common type of cancer in men. Risk of spreading: metastasis, pericardium, brain, liver, skin, bones, pleura, lymph node. Treatment of disorder: for localized forms, surgical intervention, radiotherapy. For metastasis, chemotherapy. Pleural cancer. Main characteristic of a pleural cancer. One of the reasons is prolonged inhalation of asbestos dust. Risk of spreading: metastasis, peritoneum, chest. Treatment of disorder: for localized form, surgical intervention. For metastasis, immunotherapy, chemotherapy. Digestive system. Stomach cancer. Main characteristic of disease. The disease is becoming less common in developed countries. In Japan, stomach cancer is at the high level due to a specific diet, smoked and salty foods. Risk of spreading: metastasis, lymph nodes, bones, lungs, peritoneum, liver. Treatment of disorder: for localized form, surgical intervention. For metastasis, chemotherapy. Biliary tract cancer. Main characteristic of a disease. The presence of stone in gallbladder increases the risk of a bile tract cancer. Risk of spreading: metastasis, lungs, peritoneum, liver. Treatment of disorder: surgical intervention. Liver cancer. Main characteristic of a disease. The disease usually occurs as a complication of liver cirrhosis due to alcohol, due to hepatitis B or C. Risk of spreading: metastasis, peritoneum, bones, lungs. Treatment of disorder: surgical intervention with removal of part of organ or transplantation. Metabolic radiotherapy, arterial obstruction, intraarterial liver chemotherapy, injecting alcohol into tumors. Pancreatic cancer. Main characteristic of a disease. As a rule, the diagnosis is confirmed late due to deep location of the organ. Risk of spreading: metastasis, lungs, peritoneum, liver, lymph node. Treatment of disorder: for localized form, surgical intervention. For metastasis, chemotherapy. Esophageal cancer. Main characteristic of a disease. The main causes of this disorder are smoking, alcohol. Risk of spreading: metastasis, liver, lungs, lymph nodes. Treatment of disorder: for localized form, chemotherapy, radiotherapy, surgical intervention. Small bowel cancer. Main characteristic of a disease. It occurs predominantly in men over 60 years of age. In Central Asia, the majority of patients were recorded. Risk of spreading: metastasis, lungs, peritoneum, bladder, ovaries, pancreas, adrenal glands, liver, lymph nodes. Treatment of disorder: for localized forms, surgical intervention. For metastasis, chemotherapy. Rectal or colon cancer. Main characteristic of a disease. The biggest risk factor is considered to be a diet rich in fat and poor in fiber. Risk of spreading: metastasis, lungs, peritoneum, liver, lymph node. Treatment of a disorder: for localized forms, surgical intervention, reproductive system Reproductive system, testicular cancer. Main characteristic of a disease. This cancer occurs starting from the germ cells. The disease occurs against the background of dropping of the testicles, cryptorchidism. Most often, the disease affects men aged 40 years. Risk of spreading metastasis, brain, lungs, lymph nodes. Treatment of disorder for local forms, radiotherapy for seminoma, surgical intervention, removal of a testicle. For metastasis, radiotherapy and chemotherapy. For seminoma, chemotherapy for embryonal tumor and choriocarcinoma. Cancer of uterus. Main characteristics of a disease. As a rule, the disease occurs in women over 60 years of age. Risk of spreading metastasis, lungs, liver, bones, lymph nodes. Treatment of disorder. For localized form, surgical intervention, radiotherapy. For metastasis, chemotherapy, hormonal therapy. Cervical cancer. Main characteristic of a disease. The main cause of this disease are smoking, some virus, for example papillomavirus, risk of spreading metastasis, lungs, livers, bone, lymph nodes, treatment of a disorder for localized form, radiotherapy, surgical intervention, for metastasis, chemotherapy. Ovarian cancer. Main characteristic of a disease. Typically, the disease occurs in women during menopause, but there are cases of a disease also occurring in young women. Risk of spreading metastasis, pleura, peritoneum, lymph nodes. Treatment of disorder for localized forms. Surgical intervention for metastasis, immunotherapy, chemotherapy. Local treatment in peritoneal area. Breast cancer. Main characteristic of a disease. This type of cancer is hormone dependent. The main risk factor for this form of a disease is considered to be genetic predisposition. Breast cancer is the most common cancer in women, 25% of all cancer cases. In men, this cancer occurs in only 1% of cases. Risk of spreading metastasis, brain, skin, pleura, lung, liver, bones, the lymph node. Treatment of a disorder for localized form, radiotherapy, surgical intervention. For metastasis, chemotherapy, radiotherapy, chemical castration, hormonal therapy with anti-estrogens. Tumors of a placenta, choriocarcinomas. Main characteristic of a disease, a rare type of placental cancer during pregnancy. Risk of spreading metastasis, brain, liver, lungs. Treatment of a disorder, chemotherapy is a very effective therapy. Thyroid cancer. Main characteristic of a disease. The main cause of a cancer are ionizing radiation and a rare form of genetic predisposition. Treatment of disorder for localized form, radiotherapy, radioactive iodine for differentiated form, surgical intervention for metastasis, chemotherapy, and radioactive iodine in differentiated forms. Respiratory system, cancer of the mouth, larynx, and pharynx. Main characteristic of a disease. The main reasons for this disease are alcohol, smoking, risk of spreading, metastasis, bones, lungs, lymph nodes, treatment of disorder for localized form, radiotherapy, surgical intervention for metastasis, chemotherapy. Sinus and or nasal cavity cancer. Main characteristic of a disease. The reasons may be some virus from Asia and the Mediterranean, wood powder from some exotic tree, risk of spreading, metastasis, liver, lungs, the lymph node, Treatment of disorder for localized form, surgical intervention, chemotherapy, radiotherapy. For metastasis, chemotherapy. Skin. Basal cell or squamous cell carcinoma. Main characteristic of a disease, repeated and intense exposure to the sun, is the cause of this type of carcinoma. Risk of spreading, metastasis. Basal cell carcinoma, no metastasis. Squamous cell carcinoma, bones, lungs, lymph nodes. Treatment of a disorder for localized form, radiotherapy, surgical intervention. For metastasis, radiotherapy, surgical intervention, chemotherapy. Melanoma, risk of spreading, metastasis, possible extension to all organs and tissue, treatment of a disorder for localized form, surgical intervention for metastasis, immunotherapy, chemotherapy. Blood and lymphatic system, leukemia. Leukemia is a blood cancer that results from abnormal acute or chronic proliferation of white blood cells precursors in the bone marrow. Main characteristics of a disease. The main cause of a disorder are exposure to benzene, chemotherapy and radiotherapy. In rare case, therapy for other type of cancer can cause leukemia. There are 5 main types of leukemia, acute types: myeloblastic leukemia in adults, lymphoblastic leukemia in children, chronic types: myelocytic leukemia, lymphocytic leukemia, monocytic leukemia. Risk of spreading, metastasis. Leukemia has a diffuse mechanism of spreading. Treatment of disorder, acute type of disease, bone marrow transplantation, intensive chemotherapy, immunotherapy using interferon, vitamin A derivative preparation, chronic type of disease, immunotherapy and chemotherapy. Lymphoma. Lymphoma is a cancer of a lymphatic system, spleen, liver, lymph nodes. Main characteristic of a disease. The HIV virus, which causes AIDS, can affect the development of lymphoma. There are 2 main types of lymphoma: Hodgkin disease. This disorder has a very high healing rates. Non-Hodgkin lymphomas. Risk of spreading, metastasis. Lymphoma has a diffuse mechanism of spreading. Treatment of a disorder, surgical intervention, radiotherapy, chemotherapy for aggressive types of disease. Primary tumors of the brain and meninge. Main characteristics of a disease. This type of tumors account for 1% of all cancer cases. Tumors appear as a result of cancerous transformation of a supporting tissue of nerve cells. Risk of spreading, metastasis, no metastasis. Treatment of a disorder, radiotherapy, surgical intervention. Tumors of a peripheral nervous system. Main characteristic of a disease. This type of cancer are formed as a result of cancerous transformation of nervous tissue. Risk of spreading, metastasis. Metastases are possible. Treatment of disorder, surgical intervention. Kidney tumors. Main characteristic of a disease. There is a rare form of embryonal cancer in children, nephroblastoma. Risk of spreading, metastasis, brain, liver, bones, lungs, lymph nodes. Treatment of disorder for localized types, surgical intervention for metastasis, immunotherapy. Bladder cancer. Main characteristic of a disease. The main cause of bladder cancer are schistosomiasis, chemical dyes. Smoking. Risk of spreading, metastasis, liver, bones, lungs, lymph nodes. Treatment of disorder for localized superficial form, immunotherapy, chemotherapy. For localized deep forms, radiotherapy, surgical intervention. For metastasis, chemotherapy. Prostate cancer. Main characteristic of a disease. As a rule, where disease occur in older people. It is a hormone-dependent type of cancer. Risk of spreading metastasis, liver, bones, lungs, lymph nodes. Treatment of disorder for localized types, radiotherapy, surgical intervention. For metastasis, chemotherapy, surgical or chemical castration, hormonal therapy. Sarcomas, tumor of bones and cartilage. Main characteristic of a disease: osteogenic sarcomas occur most often in young people. Other type of sarcoma can develop starting from other tissue, nerve tissue, adipose tissue, blood vessels, muscle, and are not age dependent. Risk of spreading metastasis, lungs. Treatment of disorder: for localized type, chemotherapy, radiotherapy, surgical intervention. For metastasis, surgical intervention. For lung metastasis and chemotherapy. Thank you for your attention. This material was prepared based on material from the page All Scientific. Attention! Before using various treatment and remedy, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.